for all of you, I see a lot of friendly faces out there. For all of you that don't know me, I'm Melissa Kendrick. I'm the Executive Director of Food Bank. Kathy Montero, who many of you know, who is our programs manager and everything else, and extraordinaire. So I just want to say welcome. This is exciting. We broke ground on this building on a very rainy day. I think it was February 11th last year. So in less than a year, we've moved into the facility, and we're very excited. I think this is going to be transformational for the community. We work with 150 nonprofits. Many of you are here. We are the food, or as I always say, the fuel behind Monterey County. So everybody that distributes food in the county is getting their food from the food bank. We cover 3,200 square miles. We go as far south as San Ardo, as far north as Pajaro, and then we go past Big Sur and all the way up to Watsonville. So it's 3,200 square miles, and thanks to my phenomenal staff, we do that. We serve 25% of the children in the county and 20% of the residents in the county. Our statistics regarding hunger are sobering. We rank either 56th, 57th, or 58th, depending upon the study, consistently year after year, as dead last in all 58 counties for food insecurity. I'm a native Californian. I take that very personally. I've lived in several third world countries where we couldn't feed people simply because we didn't produce enough food. But the fact that we are sitting in arguably the most productive ag land in probably the world, we're just not doing a good enough job. So hopefully with this new building and our partnerships with ag and others, not only are we going to be able to feed people, but we are going to transform the lives of people, because we need to think of this as a nutrition center. So you can see we have a kitchen. We're going to be doing all sorts of nutrition classes, because the other thing I'm terribly concerned about is our levels of type 2 diabetes, specifically among the youth in this community. And that is a disease that is completely preventable through exercise and healthy eating. It's also unfortunately become a disease of poverty. So we can do much better, and I'm just really enthusiastic to see everybody here and see some of these priorities. I think we're just going to reconfirm what we know, but I am thrilled to partner with the county Community Action Partner, Lauren, your team. I see Marguerite even came back. Talk about commitment. But your staff just does a phenomenal job, and I think we can all agree we have just strengthened our relationship, and I just love the synergy. So thank you so much for this partnership and this opportunity. And now we're going to get to the important stuff, so I'm going to let Everett take over.
Thank you, Melissa. Good evening, everyone, and welcome. My name is Everett Sibbles, and I have the pleasure of serving the current chair of the Community Action Commission. I want to thank everyone for attending tonight, and your presence really emphasized the level of community engagement we are so proud of here in Monterey County. The Community Action Public Hearing is an important event for our commission. We are here tonight to hear your voices and ensure your input is documented and considered. So again, if you haven't filled out a survey, they are on the wall, and we have commissioners bring them around to you. Our mission is to assess the needs of people living in poverty in Monterey County and develop, maintain, and evaluate community services that empower low-income individuals and families to improve the quality of their life. As a commissioner, our most important responsibility is to engage the community in the decision-making process of determining service needs and ensuring that responsible decisions and funding community programs that would make an impact where it's most needed. We hope to offer you the opportunity tonight. For my fellow commissioners, can I just get you all to stand up, please? All the commissioners. So, if you see them, please engage with our commissioners and be more than willing to talk to you and answer your questions. Thank you. And do we have any elected officials here tonight? Can I get you to stand up, sir?
You have to stand up, elected.
I'm not an elected official.
Not elected, okay. Well, thank you everyone for coming. If I may any commissioner would like to have something to say? If so, we're going to give you about 3 minutes to do that. Mr. Lyon.
Good afternoon. Some of you know me. I'm Evangelist Ron Stone. I've been a member of this commission for a few years. And a lot of people ask, how come we don't know who the commissioners are? And so this is an opportunity to get to know the people that's on the ground in the community. That's why it's called the Community Action Commission. But we can't do what we need to do without your voices. And this is an opportunity for you to speak up and take a survey and let us know what your needs are. Because if we don't know what the needs are, then the funds won't come through that will help to achieve what we're trying to achieve. So we're asking you, if you know of people who have needs, encourage them to participate, come to meetings, and if we all work together and support each other, we are our brothers keepers. That way we can get work done. Thank you.
Thank you, Commissioner Stone. Is there any other commissioner who'd like to say anything? Seeing none, also, can you please put your phone on vibrate or silent, please? And is there anyone interested in being a commissioner in the future? We have a sign-up sheet on the side, and we'd be more than happy to talk to you about that. I want to now like to introduce and turn the program over to our program specialist, is Lauren from Monterey County Community Action Partnership, to present and review the needs assessment and for public comment.
Hi, thank you. Talking about okay. So why are we here today? We're going to talk about some of the community needs and the process that community action goes through to ensure that we're engaged in listening to the community. And how do we do that? So Community Action Partnership receives funding from federal, state, and local sources, and specifically to support people who are living in poverty. With this funds, we have to write a plan, prepare a plan, and provide to the state exactly how we're going to spend these funds. Our plan needs to be based on current needs, involve public input, and with the limited amount of funds we have, we can't fund everything. So it's up to us to listen and hear and prioritize so that we can have the greatest impact in utilizing these funds as wisely as possible. We start our assessment by considering the issues that often act as barriers to getting out of poverty, understanding these factors and conditions that keep people from reaching self-sufficiency. With keeping some of these issues in mind, shelter, food resources, we also think about what can the funding that we have be applied towards. What we have are called service domains. The state sets up these different categories that help us determine what types of services can be funded. Issues such as employment, housing, shelter, but also those connections that make other services work, like case management, like getting access to birth certificates or IDs. These things allow other services to make those connections and can be helpful in making that money go further. This evening's event is hosted by the Community Action Commission. We wouldn't be here without them. They are our advisory body, and they are selected and appointed to be here by the Board of Supervisors. Everyone here is representative of every area of the county. So there are 15 total positions. There are 3 members from each district required and appointed for the public sector, the private sector, and the low-income community. So as Everett had mentioned, we do have 2 vacancies on our commission right now. District 1 in the area of Salinas and city limits, and District 4, Jamie Parker's area, which is the Seaside, Marina, and South Salinas region. So if you're interested, please reach out to our chair and let us know. I'm going to talk to you a little bit about the planning process so you get an understanding of what we're looking for and how you can help engage in and give us the input that we need. The planning process involves identify. Let's talk about how we move forward and how we identify causes and conditions of poverty. I have several copies of our current plan. That's the 2018-19 plan that we're actively in right now. We conducted a needs assessment 2 years ago that helped us determine these priorities. So you can see the data really showed we ended up prioritizing services for youth, also housing was very high. And looking at that data, we developed a place to start on what we need to do. From there, we start our collection process. We started doing our surveys back in November, the surveys that we're passing along to you. We hope that every single one of you take a survey, it's fairly short, and share it with your family, with your friends, coworkers, with your community that you know. Everybody's voice to be counted. It's important. The surveys will continue through the end of February. We also continue through data from our service providers. These are educational institutions, community-based organizations, the public sector, faith-based, private sector. These organizations that are working directly with those people that are living in poverty who know directly what the needs are. We also conduct a comprehensive literature and statistical review to develop a community profile. And then those surveys are vital. Being able to ask people directly. And we've been conducting these surveys throughout the community at local sites in North County and South County. We went down to King City, we were in Castroville. So we continue to do that as much as possible, and it's available online as well. Next process is to convene. We're here to listen. We brought together, we have our commissioners who are representatives of our public officials. Service providers are here. And then those who are directly in the community. You talk, we're here to listen. So there's several ways for you to be able to provide those comments. I want to make sure that everyone knows how to access surveys. Like I said, they're available all the way through the end of February. You can go to our website where you can get the link to go directly to the survey site. Today at the public hearing, please don't leave without completing the survey, as well as our network of providers. All of the providers that have currently funds can help you get access to our survey. Those providers, Access Support Network, Turning Point of Central California, Community Homeless Solutions, Community Human Services, North County Rec and Parks District, the Village Project, Food Bank from Monterey County, United Way, and Gathering for Women. After we collect and convene, we'll organize and draft. This part is where we organize our information, supplement it with comments from the research and the data, to write a plan to tell the state what we will do with those funds and how we plan to have an impact on poverty. I'm going to show you just a quick peek at what we're looking at the data so far. We have collected quite a few surveys already, and it is overwhelmingly showing that housing and shelter is coming out as a huge priority need. Behind that, we have education and recreational activities, and then health and behavior. But your voices can continue to fill this data and help us realize those priorities. The last step of our process is to approve and submit our plan. Over the next several months, we'll be reviewing this data. We'll go to the Board of Supervisors for approval, and then on to the state. This plan will lead new service contracts for 2020 to 2021. And if you want to keep updated on our process, please provide an email address on your comment forms or through your survey, so we can make sure that we can provide you a copy of those results as they come through. Before we get started with the public comment, I wanted just to do a quick reminder of some of those service domains to keep in mind of what the funding covers. Keep in mind these are broad categories, and there are hundreds of thousands of services that can fall under these categories. So these are just some samples to kind of keep some of those comments in mind. So with that, I want to open this up because we're really here to hear from you. For the public comment, we're going to start circulating the list, and we've got the list with, who's got the list? Arlene, do you have the sign-up list? Yes. Okay. Arlene's going to start circulating the sign-up list. So we're going to start circulating that around. Please, as you start to come up, and we'll make sure that we have order here. We'll have 3 minutes for each. We want to try and make sure everyone gets an opportunity to speak. If it allows, we'll absolutely let you put your name on the list again. We just want to make sure that everyone has that opportunity. All of this is being documented for our state plan. So it's really important when you come up, please tell us your name. Tell us where you're from and what you're talking from. If it's a community, a district, a city, where you're referencing from. If it's an agency or a school, a church, let us know where you are from. And then tell us if you yourself are low income. It helps our documentation to know if you're speaking about services for yourself or if you're talking about some experiences that you've seen and observations. Also, please focus your comments on the community needs, our assessment process, and how we're allocating these funds. Also, remember that if you don't want to come up here and speak into this microphone, because it's a little uncomfortable, we can always also accept your comments through written form, and every language is available. We'll figure out how to get it translated. So please, we have many commissioners here who are helping to document that. We want to make sure everyone's voice is heard and to make that happen. So as we start to sign up, we'll gather the first name on the list and bring somebody up.
Who's the first name on the list?
Go ahead.
Oh, you can do it from there.
Before she puts 10 names on.
Right.
My name is Mario Torres. I'm a home care provider, and I'm here to talk about the need of a health plan for the providers that we really need here in Monterey County, because right now, as I speak, there's like 600 providers on the health plan, but we do have a lot more people that don't have it. So I think that this survey and the funds that's being talked about here should or will be a big help for our county, but at the same time for our providers to add more people to the health plan. I know personally that having a health plan is very, very needed here, because I myself didn't have a health plan. And when the Obamacare was introduced and approved, that's where I ended up getting a health plan because of that. But right now, since we are over 2,000 home care providers, we only have 600 of them on the health plan. Everybody else has to be on the list. And I think that county and state will benefit if we have a health plan for these folks, because when the need arises, they go out and take care of their health. And the other hand, what they do is that they go to the emergency room, and that costs more for us, for all taxpayers. So if we can bring more resources to our program, to our health plan, it will help. The need is great, and we need it. Thank you.
My name is Kathy Montero. I'm the programs manager here at the food bank. And I just wanted to talk about the importance of food in our community. Today, we serve approximately 100,000 residents in our county. People that have nothing or are just barely surviving. What that means is we have approximately 250 different sites that I go to every year just to make sure that they're serving the population that they need to. That's a lot of different sites that are in need nonprofit organizations that come to us for food for their programs. That could be soup kitchens, men and women's shelters, youth programs, senior programs, rehab center. You know, it's a lot of just pantries that are helping the families that are in their communities. And a lot of residents here that are in need of food, they are also in need of transportation. And when we have a site that's within their walking distance from their community, that helps out a lot. I have had so many heartwarming stories from recipients of food of how much they appreciate the food because they had absolutely nothing in their cupboard. Today, we are able to provide a lot of nutritious food as well. We provide fruits and vegetables, which is a healthier diet, and it's very, very much appreciated. I hear seniors coming to me and say, thank you for the produce. We get to eat healthy. That's something that's really important for everyone, but especially children. When 25% of our kids in this county are not getting sufficient food or having to live off of a poor diet, having that fresh produce is a huge help. And seniors too, they really, really appreciate the healthy, nutritious food that we're able to give. We need to continue our program because I see year to year the need for food just increases more and more. And really food is a basic necessity in life, even above shelter. And if we didn't have food, how would we make it to the next day? Thank you.
Okay, we're back to back. So since you just heard from Kathy, and she did such an eloquent job, I'm going to speak about the population that troubles me the most. Actually, three populations. One would be the children. It is just unbelievable the fact that we're serving 25% of the county, and we are not reaching all the children in need. At the schools we serve, over 33% of the kids are homeless, and actually the schools that we serve in South County, over 45% are homeless. We've 3 times the student homelessness rate than an urban city like San Francisco. We're at 9.9%, that's just a recent statistic. So we try to do whatever we can, but the reality of it is everything is important. You know, medical care, shelter, I mean, everything is important. But the reality is if people don't have food, they can't participate in society, and specifically the children. It also has a crippling effect on their development. So that's just a huge problem. Another big population that's near and dear to my heart is the veterans, and we need to do better by them. Veterans Transition Center has been an amazing partner, but we have a disproportionately large population of veterans here. And many of these veterans that serve this country are now living in the streets, and that's just simply unacceptable. So we need to do more for them. And then lastly, I'd like to speak on behalf of the seniors, because many of these seniors, it's one of the largest demographics we're serving on the peninsula. And many of them, although they may have housing, the reality of it is they are living on fixed incomes, and they literally, once they get done paying for health care and paying for medications, there's nothing left for food. So I can't say everything is important, but I definitely place food as one of those necessities of life. It's kind of like air. If you don't have it, you can't take a breath, and if you don't have food, you simply can't do anything else. So thank you.
Adriana Delfina.
Thank you. My name is Adriana de la Peña, and I'm home care provider. They're right. There's elders that have no services. We work for people their age and disabled and little kids. And it's sad that some of the providers have to wait sometimes 2 years or maybe more to have a health medical program. It's like everybody have it but us. And when we problem with the home care providers is that the Bay Area don't have caregivers because we're not enough. We don't have good benefits or good salaries. So we really need to have at least medical services because going to emergency is bills that we have to pay for years. So that can help for us. That can be a really good program, and we can have more home care providers in that. And in Monterey County, in the South County, we don't have home care providers either. So our veterans, disabled kids have no service from a home care provider. They have to deal every day with doing anything without somebody. I know a case in Carmel, and people think, oh, because it's Carmel, is the Bay, is where all the rich live. That's a lie. Because I faced a case where a lady called me Thursday, but I'm not her caregiver. But she called me and it said that she needs one. And I said, okay, I see you Monday. She said, no, I need you now. I said, okay, I'm gonna try. So I didn't show up because I don't have an appointment. I'm not the provider. So Saturday she was so desperate that I think, well, we need to send somebody. So two caregivers that we not caregivers for her. Went there and she had 3 days, almost 4 days, sitting in the chair. And the husband on the bed. So they have to go to the emergency room. And that's really sad. So I don't want that to happen again. And that happened because home care providers all have good benefits and good salaries. So think about that. Thank you.
Roslyn Charles, and then Paris Charles will be next.
Hi, good evening. I'm Roslyn Charles, and I am from District 4, CI, the Village Project. And one of our services at the Village Project is our after-school academy. And our after-school academy offers transportation, snacks, help with homework, one-on-one tutoring when we are able to run at capacity. So right now we have over 40 students and we have a wait list that is about double that number. So our need is for more tutors in our community for the after-school program. As we know that when parents, low-income parents, and to include single parents, have after-school services, then they are able to have more opportunity to stay at work versus not being able to go to work. So that's one of the greatest needs that we have, is that we would like to be able to increase our staffing so that we can care for more of the low-income children in our community. Also, something that concerns me is that these meetings that we're having tonight don't come to our community. So it's hard for our voice to be heard because we can't get over here. So I would hope that in the near future we consider bringing, rotating meetings and bringing them over to the seaside area so that you can hear the voices of the low-income folks in our community. Thank you. Paris? Okay, she's acting shy.
Oh, it's 2 pairs. Hi, my name is Paris De La Rosa. I work for Access Support Network. We do case management. under the federal poverty line. We provide HIV and hepatitis C services to the community. And we don't just, it's not limited to Salinas. We provide services to all of Monterey County. And we work closely with a couple of the medical facilities like the Trinidad and also over in China. And we get clients. But one of the biggest things that we have, we provide syringe exchange services over in Chinatown. And we also work with a lot of clients that get infected with hepatitis C that are homeless. So we have a food pantry that we provide for our clients, and we try and I was listening to talking about food, and surprisingly, like people access our office every day to get bags of food, and we try and purchase things that are in cans that have full tops, because a lot of people don't even have can openers access, so we try and get things that are easily that they can eat in their tents and things like that. I think it's really important. It's good to see a room full of people that care about their community, and whatever particular service that you offer to the community, we just all need to continue to work together. I myself, a few years ago, have been to the Village Project, and they do wonderful work over there. And I think we just all need to work on trying to use each other's services and refer more people in and out. I started over in this field working in Chinatown at Dorothy's, and fortunately I still go over there a couple of times a week and get to stick my hand out and deal with people and help them to the fullest that I can in the community. And so we just need to continue to work together, because this is a joint effort trying to overcome homelessness and poverty and hunger. And that's it.
And then Regina Mason is next. Paris and Karen. Following Regina, we have Claudette.
Good evening, everyone. I'm Regina Mason, and I am a lifelong resident of Seaside. I've lived in Seaside all of my life, and I'm also a child of poverty. And I know that there are just so many needs that everyone's community has when it comes to poverty. I'm also the co-founder of an agency that Roslyn talked about called the Village Project. The after-school component of the Village Project is just one component of the services that we offer. We also have a mental health clinic, and we see people coming every single day with so many different needs. They probably need a community social worker, an educational advocate, someone that can show up to court for them, because I find myself as just a volunteer at the Village Project, meeting the needs wherever they are. And I have to tell you, when we refer these folks that come to the door, and this is getting more and more every single day, people are coming with more and more greater needs, then they come back and say that there's nothing to help. So, I don't think we have enough resources going into the communities, whether it's Seaside or Salinas, South County, but I do know that people are hungry, people need someone to help them advocate, we need more support to bring more of the kids into our after-school program. We let more children come into the program this year, and their issues are so great that they almost need like someone to just work with them and their parent to help them navigate all these various systems that they're faced with. And unfortunately, we don't have the capacity to do that. And there's nowhere else in the community that's able to do that either, because even though nonprofits help our government leverage their resources, nonprofits are only as good as the grants that they get in the door. And you find people like me, which I'm not a paid person, I'm a volunteer, but when someone comes in a crisis, they need someone, and organizations, all of them, need the capacity to be able to help people and meet them where they're at. So I would say that the greatest needs in the community is to look at not a cookie cutter approach, but to say, okay, what does this individual need? And then try to figure out who are your partners, is there enough resources, and you know, with the cannabis dollars that are coming in various communities here, leveraging some of those resources as well, and getting people that are being impacted, because how many people are here that are really impacted? And so those people oftentimes don't have transportation, and they're working 2 and 3 jobs to try to make ends meet, and kids are staying at home by themselves or at risk of being with a caregiver perhaps that their family doesn't really know as well. They haven't really been vetted, but the parent has to go to work. So anyway, we just see so many needs of people nowadays in that community. And it's really, when you look at the statistical data, you'll see that there is a disproportionate number of children of African ancestry that are impacted the greatest, because in Monterey County there's only like 11,000 plus African Americans, but when you look at the low birth rate, you know, the school suspensions, you know, kids living in poverty, that group is higher than any other group. It's almost criminal that this is continuing to happen, but at any rate, I just want to say that you know, everyone's needs are great, and so I think that looking at agencies that people trust and come to, and then trying to help agencies figure out how to leverage resources from other sources as well, because the money that's coming from CAP is very limited. But whatever support CAP can provide is greatly appreciated, and if it weren't for the resources certainly that we get, we would not be able to even serve the number of children that we're serving. So thank you very much.
Well, I'm also from the Village Project. We have a trio coming here. I just want to re-emphasize what both Regina and our other co-worker has also mentioned about our tutoring program. But I also want to emphasize Regina touched upon it a bit, but just the importance of what CAP does for us. As Regina mentioned, that without CAP, we would not have been able to certainly fund many of the programs that we offer that are so beneficial to not only children, but we offer wraparound services to children, their parents, their adjoining relatives. So we try to look at this from a holistic standpoint. And when we think about that, the funding that we get from CAP, and not only the funding, the support that we get from CAP. I don't know if any of you are funders here, but there are certain requirements that must be met to do that. And when we slip and fall sometimes, they're always so kind and so generous of their time, helping to explain to us what we need to do and when we need to do it. So CAP is a tremendous partner for us, not only because of the financial support that they give us, but just the support that they give us in general. And so I just want to emphasize that. And again, when one of our co-workers mentioned that our tutoring program that helps our children to not only with tutoring, but also with meals and things of that nature, we also have a component where we pick those children up from school, bring them to the Village Project. So we also need to think about how we transport those kids to and from. And of course, the support that we need for that. I'm certain that many of you also probably encounter things of that nature. So again, I'm repeating what we've already said, and again, I'm certain that our needs and our concerns are also your needs and your concern. And so one of the things that I really would like to stress, because I know we have partners in CAP, but how can we work better with our partners? How can we refer better, something that was mentioned earlier? Because we have people who come into the Village Project who not only need mental health care services, but they need physical care services. We have a poor woman who's homeless right now with her son who is disabled, and she has to travel around from place to place to place with a colostomy bag attached to her. Now that is really devastating when you think about that. But I do know that we have partners who have homeless shelters, and we have partners who offer food, like the food bank. So if we can really think about how can we better coordinate what we do so that those little holes that people slip through can be filled, I think that's something we can think about, not only as CAP funding those things, but how we can do them as a team and as a group ourselves. So with no further ado, I thank you.
And we'll start with Nikki will be next.
I want to thank the CAP. Also want to thank everybody that's here, all those that provide services to people in the community in Monterey and surrounding areas. I was impressed when I came in here. I want to thank them. I said, this is a beautiful building, and the impact that you have in all the areas that you provide food is huge. I've been told years ago by a mentor of mine that two things are very important to people who are poor and need. One basic need is food. Another basic need, with all the other services, is housing. And so we're Community Homeless Solutions. I'm the executive director. We provide housing through transitional, through shelter services, and we're now converting some of our property to permanent housing. And we're also starting initiatives to do tiny homes. I can say 4 years ago, when tiny homes was introduced to me, I got offended because I've been doing housing for many years. How would you put a person in a very small house, 200, 400 square feet? I thought it was kind of offensive. But over the years, and even knowing this over several years, that why would I want someone on the streets? Because there's so many things that can happen that can trigger mental health, that can trigger drug addictions, many things, and then you may be victims of certain crimes. If we think about what just happened, what's happening in the Midwest, how cold it's been over there, and the danger that people are placed, housing through tiny homes and initiatives that we're starting, I think is a great thing. I finally realized that tiny homes is another alternative, just like it is for our shelters in San Diego County, where we provide 50 beds. Here in Salinas, in this area, 70 beds. And like to say, maybe I shouldn't be saying this in public, but it's more than 70 some nights because of that rain, of that cold, where people don't know where to go. Just recently, in the last several weeks, we've had over 90 people. In fact, we just had a family of 9 2 weeks ago that had no place to go. So all these services are so critical because this is what we do. Years ago, I was told by a spiritual leader, "What kind of work do you do, Reyes?" And I told them we provide services to families and individuals who are survivors of domestic violence, people who are in crisis, people who have addictions, drugs, alcohol, you name it, that we provide housing, we provide shelter. And he says, well, then you are in the rescue mission business. And I think that's what we're all in. We're rescuing people so that we can help them in their journey to a better tomorrow, to a better life. And so I want to thank the commissioners. You guys have done audits at our place. You've seen the work that we do. I want to thank county board supervisors who have really caught on to the whole homeless crisis in Monterey County. the cat. Margarita's back here, who used to, 60 years ago when I met, as one of, as a contractor, now taking the lead is Lauren. And so I want to thank them. I appreciate you and I appreciate the partners. You said something very important. We go to these cat meetings, but we don't really do a lot together, and we need to in order to help rescue those that need to be rescued. So thank you.
Good evening, my name is Jonathan Mejia, and I'm part of the Century Center St. Teens Empowerment Project here in Salinas. And like most high school students in Salinas, I needed to complete my community service hours. I joined the staff program because my mom recommended me to give it a try. And to my surprise, I enjoyed what this program had to offer. I've been in this program since my freshman year, and in May of 2019, I'm on track to graduate from Salinas High School. This program has benefited me in many different ways. Such as making me more confident with myself. I hope there will be more support for this after school program so other women like me can benefit from it. Thank you.
Then we have Juanita Rucala.
Hello, my name is Paris Charles, and I am from the Seaside. And I go to Dublin Language Academy, and I am a student at the after-school program, the Village Project. And what we need there is more Spanish-speaking tutors because there's a lot of students who go to my school, and we learn Spanish, and we need more people to help us. And yeah, we need more tutors, like my mom said. And yeah, that's it. Thank you.
And then following that was Margarita Serrano.
Good evening, my name is Juanita Rucala, and I work for the Housing Resource Center. And I just want to talk about the needs. There's a huge need for families. Ray has just talked about a family of 9. My job is doing case management. There's not many landlords out there that are willing to take large families, especially if there's barriers along with, families that go through housing and they have an eviction background, they don't have the money for the application fee. Those are the services that we provide. We have housing specialists that go out there on a daily to do outreach to try and get those landlords to come in, to try to work with our programs, to work with vouchers like Section 8 or other agencies that will try to work together to try and get our families housed. So we were successful to house this family in Rome. They come a long ways too with getting other services, but the huge need out there is trying to get those landlords to come and accept our programs to help those families get housed, especially with this rainy weather, the coldness out there. I mean, it's very difficult for these children to be sleeping in their vehicles, have nowhere to sleep, and now there's a lot of families that have somewhere to sleep. So those are kind of the services that we offer here. So I would really encourage you, if you know a landlord, a friend, a neighbor that has a room to rent or a house, please let us know. We would love to help that family. Thank you.
As Margaret is coming up, I just want to invite other people, if you're interested in coming up and speaking, we still have space on the speaker list. You're welcome to speak again. Anyone here, you don't have to know much. You just have to know what you see around you. You want to speak about those service needs. Help us see what you see.
Thank you. Good afternoon, everyone. It's kind of bittersweet to come and see that you're not needed anymore. Lauren is doing a great job. And what I know about community action is that, like somebody mentioned, the money is not enough, but the work and the communication, the collaboration is great, and it could be better. And I
because knowing where the services are is sometimes better than having the money to serve that person. As a retiree person, I find myself sending families to where the services are located. There's a great need out there for information. There are so many people that don't know where to get started. So if you enrich that component, the information and referral in each of your agencies, that can go further. So I want to just encourage you to bring more agencies, even if they're not funded, just bring them and have them learn where the services are. Thank you.
Chair Allen is next, and then following Jill, we have Westwood.
Hi, I'm Jill with Northeast Place, District 1 Salinas. We focus on services for people that are extremely poor and homeless and generally chronically homeless. But I'm not going to talk about those services too much. Margarita, Regina, you're both right, there isn't that much money. And so what we find as a community, when we've got a resource that there isn't a whole lot of, we look about where to put it so that we can be the most effective. At Dorothy's Place, we serve about 1,700 different people a year with meals, prepared meals. But you know what the foundation of that is? The food. And we get our food from food banks. We get food from other sources too. But our local food bank is always dependable, always organized, always creating the best value for a community dollar. Another program that we have is a transitional living program. We operate 2 different sites. We teach people that didn't have an income before how to generate an income, how to qualify for a housing subsidy if they're disabled, how to re-enter the job force if they can work. But what's the foundation of all of that? What's the foundation of everybody's day in transitional housing? It's what they eat. How do you face the day? How do you go out and look for work? How do you go through all of these different agencies that you have to navigate to improve your life if you don't have a good foundation, if you don't have a good deal? Our folks have the opportunity and the privilege to shop at the food bank. We send a delegate, we have an appointment time, we're in, we're out, we get what we need. It's all efficiently run. We don't have to worry about where the food is coming from because this is all here. So this is a great facility, and it's built, and God knows I hope it's paid for. But what people don't think about after the facility is built is where the dollar's coming from to operate. This facility could operate for another 100 years, but it's not going to operate unless they get support. We have another program in East Salinas that is a seasonal program, and it serves 260 to 280 migrant worker families that don't travel with the crops. Maybe they want to keep their kids in school or whatever in one place, so they stay here and they tough it out through the winter. We don't have any special program for them other than the foundational program, food. And we are an extension of this food bank. We are a food pantry. We offer a few other items there once a week as well. But those families depend on us, and we depend on the food bank. So when we think about where to invest the few dollars that this community has for community action, think about doing something foundational. Think about doing something that is, I think I'm repeating something here, that is helping the other agencies serve all of that need. And I'm going to suggest we think about food.
Hi, my name is Wes White. I'm from Salinas. the president of Salinas Homeless Union. I'm also got a fiscal sponsorship with Children in the Country Life. Hopefully there's money for us too. But basically, we're doing this in negative budget. You know, homeless shelter is our big priority. And maybe we can even do it cost effective to where we just give people permission to be on a little space of land, and we call that an address. Plot number 40 out of 200, like an apartment complex, at a 5 or 10 acre plot. There's a court case that came out in Monterey County in September last year that basically says you can't cite people for unlawful camping or trespassing, especially on public property. So public property is already a venue. The amount of money that we spend for cleanups, that could be a cost savings that could actually go toward services instead of just pushing people around. In Chinatown, just yesterday, they took 3 people out, and nobody is allowed to come back on that space. And they're going to come back every day and take out 1 more. So at this point, you know, we got 3, tomorrow there's going to be 4, and the whole block is going to get taken out. All the bars were first installed on every vacant lot, which forced people onto the sidewalk. And then you're going to say you're not allowed there either. You know, these are in Chinatown, on Soledad Street. That's where all the services are. The food's there. The service providers for our caseworkers are there. You know, being able to connect these people with services. How are you going to find them again? What if they do sign up? And that needs to be another aspect of it. Is if people have signed up for services and they're connected with HMIS and cars, then that should give them a pass as long as their place is sanitary and organized. You know, food, trash, and food is organized, and that should be enough to pass people over. And I think that's one way that we can seriously save a lot of money. And then maybe that way there will be more stability. People can have consistency in their life, routine. They can actually go and get a job because address is a major barrier to becoming established again. So, you know, we're working to connect everyone with services. We're going to go representative, 10 to 10, person to person, and sign them up for HMIS, and at least get a count, because that point in time count is very tertiary, it's very hit and miss, and you're not really getting in depth, and you're not getting demographics, and that kind of data we need, and then we can't say that nobody wants help, because of course everybody wants a little bit of independence in their life, and a little bit of sanity and normalcy, and just getting scooped up and having all their possessions taken from them, having to start over on a constant basis. It's almost like, you know, they're lepers or something, and that's not how we should be treating people. It's far too modern these days to believe in such nonsense.
I have a very urgent request for the community. I'm taking on the ad hoc committee with the Community Action Commission for rent control. Now, if we want to keep our community, or we want to keep people off the street, we must do something about what is happening with the escalation of rents every year. And there is no process to keep people from raising the levels of rent above the income of our constituents. So I'm asking you to please support this fight for rent control. We're getting the attention of the Board of Supervisors. We are meeting, having these supervisors to come to some of the meetings and to support this. If we don't get the support from our elected officials, our supervisors, our state elected officials, we just keep talking about this, and we've been talking about it for years. And so if you feel like this is important, this is another housing issue, another housing emergency, and this is one of the biggest ones that we have here in Monterey County. So I'm asking you to please support trying to do something about rent control and get in touch with me. My telephone number is 831-277 5241. I'm also the executive director of the Fort Worth Environmental Justice Network. We've been working for years for our community and the people in our community. Thank you.
Good evening, I'm Margaret Huffman. I work for Department of Social Services for Aging and Adult Services branch. And before that, I worked for Family and Children's Services. I'm a resident of Salinas, actually just across the street. I'm so happy the food bank is here. The food bank is so important for seniors and families, people of any age in our community. Hunger should not happen in the greatest country in the world, nor should homelessness. We can do better, and all of you being here tonight is great. That it's a start, that we're working together to do better, and I am grateful for our partners at CAP for the programs that they do, and I agree with you that the money that's available does not stretch far enough. But the services that have been mentioned with housing and food in particular, I see a great need for our seniors in the community. More and more, unfortunately, have become homeless. And to see our frail elders on the street, again, should not happen. But thank you for being here tonight, everyone.
And then next up is David Padilla.
Hi. So my name is Victoria. I work for Training Point Agent Learning Program. So basically what we do is we work with 16 to 24-year-olds. We get them jobs. We can do like a direct placement. We try to do like a pay work. And it's kind of like an internship where they get the skills and where they get the skills, and then we try to build up their resume. But a lot of the times when we do that, there's a lot of kids that they don't have transportation. So I feel like we need more, I guess, the staff to do transportation. We need, I think this program is a really, really good program for the kids. But I also feel like our outreach is not as great. I feel like we need more staff to go into King City, to Salinas, to Brookville, or I don't know, to, I guess, sign more people up for the program.
Okay, cool.
And then next up is Dominic.
Hi everyone, my name is David Padilla. I'm an organizer with the Home Care Workers Union. You heard from a couple of members earlier. I'd be remiss to commend a lot of the work that you all do from the different agencies. You all work hard to really empower people in the community. But I also wanted to speak to the fact that it's such a shame that we are sort of talking about this such a small amount of money when there's so much wealth in the county that produces so much money. You have employers like Taylor Farms that don't have to go and beg and present a case for the subsidies that they receive from the federal government. So there's a real shame, as other folks mentioned, right? And a real contradiction. So I would just want to make sure that wherever this money goes, that it really creates the impact that folks have been speaking to. And just to reiterate the point that our members have been saying, we advocate for this monies to be put forward to a healthcare plan, expand healthcare coverage for home care workers and their families that could potentially have a real impact in the way that they're able to access healthcare, preventative care in the county. So just wanted to address those points. Thank you.
Good evening, everyone. I didn't expect to speak tonight, but I wanted to take the opportunity to thank everyone who's in the room once again. I see many different levels of individuals and agencies represented here tonight. And I work in Monterey, live in Salinas. I'm the program director for a transitional housing program in Chinatown. There's a lot of need everywhere, no matter what's going on in the nation right now. Homelessness, mental illness, hunger has no prejudice. So whoever you're representing, whatever agency that you're representing right now, whoever you know, get in front of them. Ask them, reach out, because everyone, no matter where you come from, everyone knows someone that knows someone who's been hungry, who's been homeless, who has suffered from mental illness. When it's time to vote, get out there and vote. If you have the chance, whether it's local or national, vote. Talk to your friends. Just be an advocate for someone who doesn't have a voice. And that's what I'm asking tonight. Be an advocate for someone who doesn't have a voice. And there's a lot of us out there. A lot. No matter what walk of life you've come from. Most of us are just one paycheck from being homeless and hungry.
Good evening, everyone. I'm the acting director for the Department of Social Services, and I'm so happy to see all of you here tonight. And I know our team is really, everything they do is dependent upon the input of the community. And homelessness, hunger, healthcare, all of those issues are so big, and there's precious little money, and we want to be sure that that money that's there is spent appropriately, and actually, as someone earlier mentioned, throughout the community. In South County, on the peninsula, here in Salinas, North County. And so it's a lot of ground to cover with lots of issues and lots of concerns. But I really want to commend you all for taking your time out. I want to thank Melissa and the Food Bank for hosting. We really appreciate the support. It's a beautiful place. It was our first time here. Again, thank you all, and please, speak and let us know what those needs are. And we have great staff and great people that care, and all of our commissioners are very committed to taking the feedback and the input and doing some good, making good happen. So thank you so much. Have a great evening.
I didn't expect to call this quick. I just got here. I'm running late because I have a but there's two things I want to say, and if I repeat something, just consider this a reinforcement of whatever the other person said before me. But the first thing is I need to repeat what I said at the last meeting like this that I came to, is that we still, before I do that, I'm a member of the Florida Environmental Justice Network. That's actually how I found out about the meeting, and that's why I wanted to come and speak, because that's how I found out about the last meeting. So again, my comment this time is a repeat of what I said the last time, which is, again, in Monterey County, low-income moms and working moms like myself do not have proper access to legal assistance. And having to deal with a family child matter where my co-parent is basically protected by the military, that's a travesty. I am also the mother of a special needs child, so that makes it even worse in regards to the situation that I'm dealing with and the financial situation in regards to therapies and things like that I'm having to come out of pocket for, activities I'm having to come out of pocket for, whereas, every time I go to child support and say, hey, this is a new thing that I'm having to pay for, they're like, your case is so complex, you really need to get a family law attorney. And then they refer you to the legal assistance, which you pay $40, $50 for a 30-minute consultation where they tell you, well, we can take your case, but I'm going to charge you $200, $300 an hour. No working class, low-income mother can afford that. So we need to get that taken care of. I'm often told if I lived in San Francisco or Los Angeles, I would have direct access to an attorney that would actually prepare my documents for court. And also may even represent me in court or help out assist me in court. But here, there is nothing. And it's not just family law, it's criminal law, it's educational advocacy for children that are special needs. This again, we need legal assistance. And, having returned here back in 2011, and having met the director of the Court Environmental Justice Network, LeVon Stone, who's tried to take me different places to get me help. In 8 years, I'm still in the same situation, so that needs to change. The other thing I wanted to speak about is this Urban Revitalization Council that the President has announced when he signed the bill in December of last year. It's actually the way that it's being basically explained in our community, where it's actually the opportunity zone, because low-income and working-class communities have been turned into opportunity zones. And the thing is that when it comes to this next step of regulations that's going to basically regulate this wealthy person's tax shelter, because that's basically what's going to happen. It's going to end up being gentrification and blood on steroids. And the thing is that, having gone to the expo and gotten information about this, I feel like the community that has been impacted needs to be able to have a voice regarding this, and we need to start talking to our legislators about this, because again, once these developers and local families start coming in to invest, it's supposedly for revitalization, but if you've ever lived through gentrification before, then you know that it's basically displacement of working and poor-class people. So we need to start talking to our elected officials and letting them know that we will allow this, but we want a voice in regards to what's going to happen in our communities. Thank you.
Thank you all. That's the end of our public comment. I just want to, offer that, there's still food available, and we're hoping that everyone here doesn't leave without taking a survey. All of our commissioners and the staff will be here to ensure that everyone's taken a survey, that you have the links to how to access that survey back when you go home, back to your community, back to your agency, back to, your school, your church, whatever that is, to help us make sure that that survey touches as much of Monterey County as possible. We've got people in the cards here. Please make sure that your voice is heard, that your community's voice is heard, and help us identify those needs. And and if there's written comments, I know it's weird to stand up here with a microphone and speak in front of a group. We'll take written comments. It's not too late to submit those in. If you want to send something to our office, we have brochures that have our website on there, how you can get those comments to us. We'll continue to gather both the surveys and your written comments through the rest of the month. So definitely not too late to